Hello and welcome to Timeline, the show that unpacks the issues shaping our world and the story defining our future. I am your host, Sharon Ajan. Of course, I'm not doing this alone. I have my co-host with me.
Hi! Of course, this is Hannah Omokafe Dennis, and it's always good hosting with you, Sharon.
Of course, Omokafe. And today we have a guest who is a medical doctor and the founder of InspireX, Fervent Idakwo.
Thank you.
It's good to have you with us.
Yeah.
How are you doing today?
Doing all right.
Oh, amazing.
Okay.
Yeah. Well, we'll be going on a short break, and when we return, we'll unveil what conversation and topic we'll be treating today. Stay with us. Welcome back. If you are just tuning in, this is Timeline. And today on the program, we take a closer look at the topic, life expectancy, a key measure of our nation's health and well-being. Now, across the world, people are living longer than ever before, yet the gaps in how long and how well we live remain wild. What determines how long we live? And what can be done to improve both the length and quality of life? And of course, those are the questions we definitely would be answering right here on the show, because who doesn't want to live long?
I want to live long.
Of course I do, right?
I don't know the audience. Of course. And there are several reasons or causes why lots of people do not live long. But one of the things I've been able to find out is some people's lack of access to basic amenities. Let's say water, or maybe a good house, or maybe good access to any of those things. But of course, this is why we have Dr. Fervent right here, who would explain everything.
Let's dive right into the conversation. And I would like you, of course, to start off with explaining to us in simple terms, of course, what life expectancy is and why is it such an important public health indicator?
So life expectancy, like you said, simply put, is how long we expect a person to live from the time they are born, based on age-specific and sex-specific death rates at the time that they are born. So this is important because it gives a snapshot of the state of health in the country at a particular point in time. And so that's basically what life expectancy is, and that's what it does for us. It helps us know how effective our health measures, how our health system is, how resilient it gives us a picture of that.
Quite interesting. Of course, just like I rightly said, over the years, there've been like a gap. And, people might be wondering, what gap? When you talk about life expectancy, what are the gaps in it? So I would like you to share with us, how has life expectancy changed over the years globally and locally?
Okay, so good thing is life expectancy in Nigeria has been improving over the years, actually. But yet, it's still below the average for the world. And sadly, it's still one of the least in Africa. Okay, I mean, giant of Africa, but in terms of life expectancy, we are still at the bottom, actually. The global life expectancy currently is 73 years. And in Africa, it's 63 years, generally lower. But when you come to Nigeria, it's at about 56 years.
That's quite low.
So, and it's necessary to point out that this is not, when we say the life expectancy in the world is an average, 73. It doesn't mean that every country has that. There are different values. For example, Nigeria is 56. There are different values when it comes down to Africa. Algeria, for example, is about 72 years or thereabouts. While the average is 63. Then when you come down to Nigeria, it's about 56. So this is how it is currently. It doesn't necessarily mean that no one is going to live beyond that, because of course people do live beyond that age range. But it just tells us that based on what we have now in our healthcare system, based on what we have with respect to the level of the economic level of persons, based on our traffic laws and regulations, safety, and all of those, that persons are likely going to live up to this point. So basically, we are saying if you live up to 56 years, you've tried.
Interesting.
So what are some of the basic factors, that causes this? Like, while you were talking, you mentioned the fact that Nigeria has one of the lowest life expectancy rates in the entire Africa. So what are some causes, some basic causes, and even advanced causes of this?
So The things that we're looking at is the under 5 mortality rates, generally child mortality rate, but under 5 is very important to us in healthcare. And then we're also looking at maternal mortality rates. We're also looking at the level of education of people, workplace regulation. We're looking at road safety. All these things play a role. We're looking at mental health, of course, in the bigger picture of health. All these things play a role in how long a person is expected to live. You know, when you come to the healthcare sector, for example, you have your health infrastructures. The fact that somebody is sick doesn't mean the person has to die. But if the person is sick in a place where you cannot access healthcare, the person might end up having to die. Surprisingly, malaria is still a leading cause of death in Nigeria. I mean, when last do you hear that someone died of malaria, but it's still a leading cause of death because there are many persons in Nigeria who don't have access to healthcare. And when we talk about access to healthcare, we're talking about timely access to healthcare. You might get to the hospital, but if you're already dead before you got there, you have access, but it's not timely. You understand?
Yeah, true.
We are in the city now, but if you go to the villages, there are places where you have to travel as long as 3 hours to go to a hospital. And once that is the case, you know that the delay is more than 3 hours because you're going to delay in making that decision first off. You're going to ask yourself, is this serious enough for me to travel 3 hours? If the hospital was just by your house, if that's what you have to do, you're going to think about it first. So that's some delay. Then you decide that you want to travel 3 hours. Of course, there's going to be some delay getting the transport. By the time you get to the hospital, there might be some delay in you being seen and all these things, reducing the access to healthcare and all of that. And so there are just some things, I mentioned the economic status also. Of course, if you cannot afford healthcare, it's just what it is. I've had persons walk into the hospital and I'm literally telling them that you could faint as you're leaving this hospital and they tell me I have to go get some money. Do you understand what I'm saying? There are conditions where we would have to say, we are going to treat this child regardless. We know you don't have the money, but we'll just do what we can do because we can't let you live like this. Expectancy, road safety, I mentioned that also, and all of those. Of course, accidents is also one of the leading causes of death that reduces life expectancy.
Quite interesting. You've mentioned quite a number of factors: infrastructure, access to healthcare, road safety, and of course, quite a number of them. Now, in your own opinion, I would like you to tell us which of these factors, genetics, environment, or lifestyle, which of them plays the biggest or is the biggest factor when it comes to life expectancy?
Of the ones of these three that you've mentioned, lifestyle and environment play a bigger role than genetics. There's a lot of things that our genetics predispose us to, but most times, if our genetics is going to cause us to die, we'll die from early life. You will die. The fact that you are alive means that your genetic makeup supports life. Okay. All right. But there are other factors, environmental factors, lifestyle factors that play a role in that. Okay. So if a child is to start smoking by 5-year-old, we are already seeing problems that are going to happen. Yeah. Very likely going to have lung cancer, very likely going to have upper respiratory tract diseases and things like that. And then, of course, the environmental factors, if you go to, the Niger Delta, for example, where you have a lot of gas flaring and all of those, the air is more polluted there. And so persons in those areas are more at risk of upper respiratory tract infections. Okay. So these are some of the environmental factors, and of course, the road safety would fall into those kind of things, also environmental factors. In the same way, lifestyle, I mentioned that smoking, the kind of food you eat, the cleanliness, the sanitation of the area you live in, your toilets that you use and all of this. So this play a bigger role than genetics. I mean, good thing that genetics doesn't play a very big role in it. If not, it will be a doom for, if you don't have the right genes, just know you can't live that long. But it's not. Even persons with, say, sickle cell disease and all of that face a lot of challenges, in the course of their lives. They can live healthily, actually. They can live healthily with proper lifestyle modification, with proper attention to environmental factors and all of that. They can live a very good, appreciable life.
Okay. Let's clear this myth. Is it true that if you live in the village, you tend to live longer than those who live in the city?
It's neither there nor here. It's yes and no.
Okay.
It's yes and no. So moving to the city has its perks, and then there are disadvantages also. And staying in the rural areas has its advantages and disadvantages. If you come to urban areas, for example, there's more active lifestyle. I mentioned one of the things that can affect your life expectancy, which is road traffic and all of those. In the village, you don't have those. Yeah, you're less likely to be hit by a car.
Okay.
So that's one of those things.
All right.
The mental stress in the city is more. Okay, mental stress in the city is more. The quality of the food you eat, I mentioned air pollution, it's more in the cities. All right, you see more of non-communicable diseases, heart failure, hypertension, because of the kind of foods we eat, generally in the city. That's where you see more of your coke and sugary foods. But even in the village now, we have coke too, isn't it? But when you go to the rural areas, one of the big challenges in the rural areas is the low level of education, the low understanding of how health works, and the lack of access to healthcare facilities. These are one of the biggest things that's make them to die avoidable deaths, when a mother doesn't get proper antenatal care. Okay, some deaths that could have been avoided for a newborn would not be avoided, okay? She ends up, the child may be born with some abnormalities that could have been avoided if she had proper antenatal care. These are some of the things you'll see in rural setting. However, in rural setting, you are less likely to see someone who sits at home all day. It's going out, the person is working, physical exercise is good for the body, they are eating natural foods, right from the farm, less processed foods and all of that. And so they are less likely to develop diseases like diabetes and hypertension and the rest of those. So, like I said, it's a mixed picture.
Okay.
Interesting. When I was going through the World Health Organization report one time, and, they stated that during the COVID-19 season, that the COVID-19 took about a decade long of progress in healthy longevity. And, thinking about that, it's really sad because, you mentioned some statistics before we dived into the conversation properly. And, seeing that, you would see that COVID-19 really played a huge part in reducing the life expectancy of literally the world globally. And I just wanted to put that in perspective, just wanted to talk about that before we go on a break and, of course, talk about social commentaries, right? All right, we're going to go on a short break now. And when we return, Omo Cafe will take us through social commentaries. Stay with us.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us.
Welcome back. If you are just tuning in, this is Timeline. Omo Cafe, over to you.
Of course, over to me. This is social media commentary in case you're just tuning into Timeline. And there have been a lot of comments, of course, on life expectancy around the world, in Nigeria, of course, in Africa too. And this one is from Dr. X. It says that Nigeria currently holds the lowest life expectancy in the world, 55 years. And the World Bank also estimated that 63% of the population lives in poverty. At this point, it is quite ironical to wish anyone long life and prosperity.
That is so, I don't know, it's like a mixed feeling. You are sad at the beginning and you are like laughing at the end.
Oh my goodness, what do you have to say about this?
It's the irony of life.
Yeah.
Statistics is something I always love. But like I said at the beginning, this is an average figure. It doesn't apply to everybody. There are persons living up to 100 years in Nigeria. So if you're wishing yourself long life and prosperity, it's not wishful thinking. Okay. It's not wishful thinking at all by no means.
Okay, this one is from Joshua Oster Maurice, crafty CEO, that says that, does he know that our life expectancy is lower because our young people die of overdose? He was responding to someone, suicide, homicide, and increased automobile crashes at higher rates than other countries. It is not a lack of healthcare. If I live to 70, I will likely live another 15 years. So there was a social media banter, of course, on Twitter, X, you know how it is and everything. And so this guy decided to respond to one of the people who he was having a banter with. And he of course, he had to ask him this question. If I live to 70, I will likely live another 15 years. So is that like a short thing? If I live to 70, I'll live another 15 years.
Nothing, not certain. Okay, nothing is guaranteed. But I don't know if that tweet was from someone in Nigeria. Like I said,
it was from someone in Mozambique.
Mozambique. Well, regardless, whichever it is, mental health still plays a significant role, depending on the country you're in. I know in places like US, mental health is more of an issue there. In Nigeria, it's also an issue. But we have a lot of issues that come before But in itself, it's a very significant issue and all worthy of our attention.
Of course. Now, this is our last social media commentary. Of course, it's an X from X. It says that this is from Brenda Through and True. It says, Dems United proud to, before vaccines, 1900, the average life expectancy was 47.3 years. Now, leading causes of death, pneumonia, influenza, tuberculosis, diphtheria, smallpox, measles, typhoid fever. Average life expectancy today is 78 years. Vaccines work. Vaccines save lives. This is what she's saying. According to her, of course, that life expectancy is 78 years because of vaccines. Do you think vaccines are important?
Yes, vaccines are important. Very important.
Okay.
I don't know if we have the time to begin to talk about all the reasons why persons are a bit hesitant to vaccines, but interestingly, Nigerians are more open to taking vaccines than what we saw in America during COVID-19 and all of those. Vaccines are important. They actually do save lives, So what we do with vaccines essentially is that you're preparing the body to respond to illnesses. That's essentially what you're doing, such that when a child falls ill for the first time, it doesn't have to be as severe as it would have been without that vaccine. And that's what you're doing with vaccines. And in some cases, it is so significant that the person does not even develop the illness. All right. I mean, take, for example, tetanus vaccines that we give people. A lot more persons would have died from tetanus without those vaccines, or polio, for example. A lot of persons would have died from polio.
I've seen the effect around because they maybe didn't take the vaccine.
Because they didn't take, and it was worse. Okay, so there are many factors that have played to make increased life expectancy. I think that's in the US, that was 78. There are many factors that have played to that, but vaccines is one of those things, and it's one of the reasons why, for example, in Nigeria, we get sponsorship donations that help us to make those vaccines free and available in basically any hospital you could work into.
Talking about increasing life expectancy, what role do you think the government and, of course, public health organization, what role do you think they can play to help increase the average life expectancy of their citizens?
Okay, so one thing the government can always do is to strengthen, capacity, in infrastructural capacity, and of course, human capacity. We'll talk about infrastructure for a while now. It goes beyond just having the buildings. It also goes into having the equipment. It goes into maintaining these equipments and making them available. You would not believe that there are communities, cities in Nigeria that don't have blood banks, that don't have an MRI. You have to travel between one state to another state to do a scan to see what's wrong with maybe perhaps if there's a brain tumor or something. And, so these things should not be happening. These things should not be happening. The government should do more to make these things available, to make these things accessible. Apart from direct investment into the healthcare sector, they can do a lot more to make Nigeria more open, to be a better place for investments, so that we can get other foreign players who can come in with their expertise and be able to help us in the healthcare sector, And from public health perspective, of course, we can always look towards human capacity development, the better training of the doctors to be able to do what they need to do, the nurses, the health assistants. If you go to some communities, for example, what you have there are community health extension workers too. That's what you have there.
No doctors,
but they can manage the basic things. Okay, they can help a woman give birth in an uncomplicated case, and when it's complicated, they can identify it and move them to the city or to a nearby hospital where they can get assistance. All these things need to be put in place, for us to have a robust healthcare system. But I also mentioned that to improve life expectancy is not just within the healthcare system, okay? You can go to your workplace. If you don't have proper safety rules, safety regulations say on an oil rig, you're going to have a lot of persons dying. You're going to have a lot of persons having their fingers chopped off and all these kind of things. And there needs to be regulation around those kind of things. There need to be regulations. So it goes you mentioned public health. Public health, interestingly, goes beyond the hospital. And that's something I'm particularly interested in. It goes beyond the hospital. It goes into the workplace, goes into road, goes into governance, so it goes beyond the hospital, really. If we've seen that persons who are more educated, persons who are wealthier, have higher life expectancy generally. So improve the general economic state of the country, and you would see that the life expectancy will also improve.
Another chance, if you have money, your life is definitely extended.
Because to add to what you've said, it's not just about the government, of course, and of course not also about the public health organizations, about ourselves also. You made mention of the fact that if you have money, you live longer. Why? Because of your diet and your exercise, your basic things that will I say grassroots or an average person would not normally do. And when you do all of that, there are chances of increasing your life expectancy. So what do we do now in that case? Is a rhetorical question. You don't need to answer that. All right, let's move on. I would like you to share with us what role do you think mental and emotional state play in, of course, increasing the life expectancy.
Okay, so mental health is, in fact, health. I think, let me put it that way. If you want to define health, if you want to define what it means to be healthy, it's by WHO definition. And we already knew this before it was put in that fine, beautiful definition. It's not merely a state of physical well-being, but a state of mental and even spiritual well-being. So all these things are encapsulated in health. Okay? And when it comes down to mental health, for example, one of the things we're always concerned about is suicide. But suicide is at the end of that spectrum. That's where the life comes to an end, okay? But there's also depression and all other manifestations of mental illness in between that affect one's ability to be a meaningful contributor to society, okay? And that affect one's ability. Take, for example, someone is very stressed, is feeling sad, unhappy, goes into the road and his attention is somewhere else. He drives anyhow, he knocks down someone. That person is dead. Himself or herself could also die in the process. So when we're looking at mental health, aside suicide prevention, we're also looking at other spectrums of manifestations within that could affect the way we live our lives, that could affect the extent to which we could live our lives. We're looking at the whole spectrum of that. And mental health is, it's a broad spectrum. It's a bit complex. But generally, what I would always say to persons on mental health and all of that is, try as much as possible to relate with people. It's very important. And when I say relate with people, be social. Be social. You don't have to be the noisy person. You don't have to be all outgoing and all of that, but communicate. Let people know what's going on with you, whether or not anything interesting is going on with you. That should always be part of the conversations, and it should be truthful. It should be honest. Okay, and we should be ready to engage with people in that when they are being open with us, because one of the things that one of the ways we address mental illness is actually being social. For example, when you go to a therapist, what is the therapist doing for you? The therapist is talking with you. The therapist is doing for you what a friend would do for you.
Okay.
Is listening to you. What are the challenges? Why do you think this is happening this way? Okay, have you thought about this? The person is listening, is being paid to sit down and have that conversation with you. And so that's why you see that, for example, in the UK, in the US, they have a higher prevalence of mental health conditions because the system there is really, really, if you have to be at work by 8, you better be at work by 8.
Yeah.
You know, and I think some time ago I saw that in America you get about just 2 weeks of break or formal break in a whole year and all of that from work and stuff. So it's really rigid. You have to show up at work. If you have persons that are outside Nigeria, UK, Canada, that's what they will always tell you. It is stressful. It is stressful, and the way the system is structured there is much of family support is often not there. So you come back home after a stressful day, your neighbor is inside the house, you don't get to talk to him, you don't get to, if you play your music too loud, they may call the police and all those kind of things. Okay, so the more social I think perhaps it's one of the positive things for the rural dwellers that you brought up. They don't have a choice but to be social, you know, to communicate, to talk. A problem, how do they say it?
Shared is a problem half solved.
Yeah.
Okay, so that's something I would always bring forward. I mean, before you need to be in the hospital, before it gets so serious, I need to see a doctor. Try as much as possible to be open, to be sharing, and we should also try as much as possible to listen to persons, to provide that ear, you know.
Okay, I like that, but let's start to, draw the curtains close. What are some practical ways? I know you have mentioned talking to people and everything. What other practical ways can, a person, an individual, increase their own life expectancy?
So, let's take the factors again. Let's start from when a child is being born. Let's see if we can track that down to when maybe to 50 years about life expectancy. Okay. So before the child is born, a mother should register for your antenatal care. In most places, it costs you little or nothing. If you can't do that, okay, even if it means visiting the hospital once in 3 months, is better than nothing. Start that. Let's prevent the things that are preventable for the child before the child is born. When the child is born, let's take the child for vaccinations and all of those. Get the vaccines that you need to get. Those are going to prevent some illnesses in the process. I mentioned that one of the most common cause of death, mortality in Nigeria is still malaria. Okay, so sleep under mosquito nets, spray insecticide, clear waterlogs from the back of your houses and the gutters and all of that. Have a clean environment. That's still the basic things are really powerful. And sometimes persons tend to think that because something is easy, it's not as impactful, it's not as powerful. The basic things are really that important. Okay. So basic things like that are a good stepping stone. Then your physicality, it's important. You exercise, you move around. If you have such a work that keeps you in a place for a long time, make sure you find time to exercise. The way you eat, the things you eat are very important. Avoid smoking if you can. If you can, I think you can just avoid it. Avoid drinking. Avoid hard drugs entirely. Not if you can, just avoid it. You can. You actually can. Okay, so avoid it entirely. And when you have some illness, present in the hospital as early as you can. Okay, I know that coming to the hospital can be a bit stressful sometimes. I sympathize with patients because sometimes it means leaving your business for a whole day. Sometimes it can mean that, but still, better safe than sorry. Okay?
Exactly.
One of the big issues we have in our healthcare system now is that patients present late. Okay, they present late. For example, the specialist hospital just closed by. A lot of persons will tell you they don't want to go there because they have this feeling that, if I present to the specialist hospital, I might end up dying here. Yeah, you might end up dying because you came when you are very close to dying. It's a sad thing, but
exactly.
So present early to the hospital is what I'm saying. If there's an issue, come around. Let's see that. It's better you come and we tell you there's no problem. Go back home. Than you don't come and then there is a very serious problem that we cannot manage effectively. Okay. Yeah. So physical health, diet, nutrition, in your workplaces, there should be, as you do your work, take proper safety measures. Use PPE where you need to use them. Wear your nose mask where you need to use them. Yeah. Continuous exposure to things like sawdust can predispose you to illnesses like chronic bronchitis and all of that. You work in a factory where they use different kinds of gases. Put on those face masks. Yeah. If the office place won't provide it, provide one for yourself.
Thank you so much, Dr. Fervent. Yeah. To close the conversation, in just a minute, please. life expectancy is embedded in the SDG 3 that says ensuring healthy life and, of course, promoting well-being for all ages. Now, what timeline do you think we are? And we are in, of course, to achieving this SDG 3 because it's quite important in relation to even life expectancy.
I cannot put a number to that. I honestly cannot put a number to that. But what I do know is that globally, most countries are behind schedule on meeting up with those goals. And Nigeria has long stagnated. For over 2 years now, we've stagnated in our progress towards that. But the beautiful thing about things like SDGs and all of that is that in the enactment of these things, we acknowledge that there are difficulties, that there might be difficulties in achieving them. So what we need to do at all points is to see that we are making steps in the right directions. We are doing the things that we need to do to improve, general well-being and all of that. I don't want to say that by 2020 we would not have, but if we can,
2030, right?
By 2030, rather, sorry. If we can keep moving the needle forward, if we can keep improving every day, every month, making sure that things are getting better, we are on the right track. We are on the right track.
Exactly. Thank you so much, Dr. Fervent. It has been quite an interesting conversation, right?
It really has been. I've learned a whole lot.
Yeah, I'm quite educated.
Have money.
Yeah. All right, thank you. Yeah. Well, that's where we draw the line on timeline. Remember, life expectancy is as important. Of course, the system contributes to the life expectancy as you also contribute to your life expectancy. So do what you will with this information. I remain your host, Sharon Ajay, and of course,
this is Hannah Omo-Cafe-Dennis. Like I said, have money, because that is what our doctor right here said is part of how you can, of course, improve your life. But away from the jokes, you know that you also have to take practical steps to ensure that your life lives or is you exist longer than what the numbers are saying. So just stay safe as always.
Until next time, see you again.